This is Cathey Horsak with the Alpha One Foundation, and I'm the Director of Community Programs. And one of our programs is our virtual support group. And tonight on this virtual support group, we're going to be talking about another one of our programs, which is our peer guides. And the peer guide program basically connects an alpha with another alpha, or a caregiver with another caregiver, or a mom and dad with another mom and dad that has had a similar experience. And so our first line of peer guides are our support group leaders and our AlphaNet coordinators. They automatically serve as peer guides to the alphas that they work with, the alphas in their local support group, and with the AlphaNet coordinators, the alphas that are subscribers to the program that they're working with. So they are our first line of defense, if you will, with our peer guides. And then from a parent standpoint, parents with children who have been diagnosed with alpha-1 liver disease, we have a group of parents that have signed up to be peer guides to new moms and dads as they have received a new diagnosis with their child. So that is, and we have our caregivers who also are available to talk with other caregivers. And tonight we have several of our peer guides on the call with us. Sheila is in the Massachusetts area. Sheila is a support group leader, and she is also a nurse. And she has been a peer guide for people who are lung affected, and she's also been a peer guide for people who are going on oxygen for the first time. Sheila's been an excellent peer guide for several alphas to help them understand the importance of being placed on oxygen and following through in those doctors' office orders. And Daryl Nall is one of our AlphaNet coordinators, and Daryl has served as a peer guide to many people in the community. He has had a double lung transplant, and so he serves as one of our peer guides for double lung transplant. Do we have someone new joining the call? Okay. We have Ken Benson on the call, and Ken is one of our support group leaders. He's a lung-affected alpha. Patty, too, is she was a former support group leader and also an AlphaNet coordinator, and she's still serving as a peer guide for us and is a lung-affected alpha. So she's got a wide range of experiences there. Angela Merkins is one of our support group leaders, and Angela really serves us twofold as far as peer guide responsibility. Angela's father had a liver transplant, so she went through that whole process with him as one of his main caregivers, and Angela is a lung-affected alpha. And we have Ted Green in Louisville, Kentucky, and Ted is one of our support group leaders, and he is on the transplant list. So he has had a peer guide that he has talked with, other alphas in the community that have had transplants, and then he is a support group leader, so he has served as a peer guide for the local alphas in his support group. So we've got a couple of people on here that are not peer guides and are probably just interested in what the program is all about. So I wanted to give you kind of a brief introduction. And Daryl, I'm going to start with you. Would you just kind of share one of the experiences whenever you've been assigned a peer as to, what you benefit from it, how you benefit from it, and how you think that the people that you have worked with as peer guides have benefited from it? You don't have to use anyone's name, but, if you talk to another alpha that is considered transplant, and then what that process was.
Yeah, you addressed me, Daryl, right?
I did, Daryl.
Yeah, okay, thanks. My hearing isn't too sharp this evening. Batteries went dead on my hearing aid. Anyhow, having talked to quite a few people that were either contemplating lung transplant or had just done the evaluation, I think what I've provided most of is getting rid of the fear of the unknown. You know, I was there at one time, and that was my biggest fears were what I didn't know. And I think the whole peer guide thing can be summed up in paying it forward. You know, in those days, and when I say those days, that was about 15 years ago, there were people that helped me, you know, gave me the advice of their experience. Mary Pierce was one that provided that for me, and I'd like to pay that forward, and that's why I do this, and it makes me feel good to serve that function. But again, having been through these processes, I think, I've been told this by the people I've talked with who are contemplating transplant, has helped them a lot in them knowing what to expect has allayed many of their fears. Just as an example, many people fear the whole pain and trauma of, you know, having their chest cracked open, and there isn't anything light about that. You know, but when I assure them that the pain management at the transplant centers is fantastic, and it was only about 35% of what I expected, pain-wise and trauma, I think that gives them some ease in the whole deal. So, again, peer program to me is paying it forward. That makes me feel good, and hopefully benefits the people I'm talking with also. So.
Thanks, Daryl.
Thank you.
Do we have? Absolutely, thank you. Do we have some people on the call tonight that would like to ask a question of one of the peer guides? Okay. Sheila, would you share with us, you know, what your experiences has been as a peer guide, serving as a peer guide to someone, and the benefits to you as well as the benefits to the person?
Well, I think I've done, I know you've called me several times when you've had people that were supposed to be using oxygen but weren't really using it, because we both talked about my experience, and I fought using oxygen for a really long time. I know I was supposed to use it, and I knew I felt better when I did use it, but that's that old vanity thing. I didn't want anybody to see me with it around my face. And it's just something that takes time to get past. And when you're supposed to be using it and not using it, you know you're hurting yourself, and you need somebody to tell you that it's okay. We understand that this is what you have to do at this time. It will get easier. And just knowing that you're not the only person that feels this way helps some people get past it so that they could go on to the next step and accept the fact that, yes, I need to use it all the time, and I'm going to feel better if I do this. So I have to suck it up, and I just have to do it. And people just need to hear that, and they need to hear it in the terms that they can understand. And when somebody doesn't want to use oxygen, all they're really doing is hurting themselves. And you just kind of have to find an easy way to say that. And I mean, even now, well, I don't have a hard time using it anymore, but I still talk to people about it all the time. Not so much through support group, but, you know, people just don't want to use oxygen. They don't. I never wanted people to see me using it. I mean, I'd be using it as soon as I saw somebody down this row in the grocery store. I'd whip it off my face so they wouldn't see it on my face. And they were still carrying it. All they had to do was see it around my hip, and they could see me using it. But it just was something I didn't want people to see. It took me a really long time to get accepting of the fact that I had to use it, and people had to see me using it. And it was just an experience that I had gone through that I could help other people getting into that stage of 24 hours a day, 7 days a week of oxygen use. And hopefully I made a difference in some people's lives, and I made them accept the fact that they had to use it a little bit sooner than they would have otherwise.
And I think you did, Sheila. Talking with some of the people that talked with you, I appreciate that. So, Patty, would you like to share an experience that you've had as a support group leader or an AlphaNet coordinator in serving as a peer guide to a patient?
Well, I think for me, I would just say, certainly to Sheila, as far as oxygen is concerned, I have always gone back to my first experience in being diagnosed with just sleeping with oxygen in the beginning, and how freaked out I was and how alone I felt, and just being able to talk to folks and being able to identify with those particular feelings that they're feeling, and always telling somebody just try to go into their local drugstore just for 5 minutes, just for that one thing, wearing your oxygen, and then coming out and trying to feel comfortable with that. And for me, it was kind of going out into my neighborhood on a walk and just knowing that everybody in my neighborhood was just really staring at me. And one person stopped me and said, "Hey, what's all that all about?" And I was able to tell him what it was about. And all of a sudden, I felt empowered by that. And knowing that, gosh, I have to wear oxygen or I'm not going to be able to feed my heart and my lungs and my spleen and all of my other organs. Besides that, it's just that initial diagnosis of alpha-1 and the powerlessness that we feel, and the fear, and being able to talk to somebody who has a little bit of strength in their voice and say, "Wow, you go through that too?" And all of a sudden we're not alone, and all of a sudden we become a part of a family, and somebody has somebody to talk to. And when I was first diagnosed, it certainly was true for me. I hung on every word of the person on the other end of the phone, and I longed and waited for that next month when that person would call me so that I could ask more questions. And just having somebody to walk alongside, to me, has always been so important, so that we feel like we are a part of instead of outside of.
I think Patty brings up a really good point. I think everybody that first receives their diagnosis of alpha-1, their doctor has maybe told them that it's a very rare disease, and maybe they're the first patient that they've even seen with it. So that makes them feel very isolated, and to be connected to someone else who's walked those steps ahead of you is a very comforting thing. Many of you have become lifelong friends with some of the people that you have served as peer guides for, and in our community, many have been peer guides. You start out as someone learning from another alpha, and then a year or so later, you're calling and volunteering to be a peer guide, and you're peer guiding to another newly diagnosed alpha, or an alpha that's facing a new situation. So, Ken, do you have something you'd like to share with the group?
Cathey, I think before Ken gets in, I think what you said means everything, because that's exactly it. I mean, I may not have expressed it that way, but it's just this one person telling you that what you feel is okay.
Mm-hmm.
Mm-hmm. And it's a very important part of all of this, be it a support group leader doing it to another patient, somebody that doesn't want to use oxygen. No matter how you connect, the connection is there, and that's exactly what's important.
Right. Absolutely. Ken, would you like to share?
Well, I had been diagnosed for a while, and like most everybody else, felt all alone in the end zone out there until finally got asked to come to a support group by people who apparently were looking for people like me. And it wasn't that much after that when I ended up becoming the support group leader of that group. So it was really a question of people in groups raising questions and not really having answers, but listening to them the best I could. Mm-hmm. And then we would go together on a discovery journey, I suppose, and over time got to know other people in the organization, the association, staff, and all resources that we could tap into. So over time I learned more and more, but what it really came down to was taking the time to listen and just let them know that there was a whole family of people who they could say anything they wanted to about this alpha thing, and there's no need for embarrassment or anything else. It's like the family that you get along with. So it's gotten to the point now, and it was mentioned before, the paying it forward thing. Had it not been for that lady who ran the support group calling me up and inviting me to come to that, without her, I really doubt I'd be here now. So just trying to give an ear and a hand to others who are in the same position I was, and hope I can do even a portion of what she did for me.
Thanks, Ken. And I think Ken makes a really good point. The main thing of being a peer guide is sometimes not talking and not giving advice, but just listening. And that's a big part of you have to listen to someone and really hear what they're saying before you can help them. And sometimes they're really not asking you for anything except just to listen to them and to acknowledge what they're saying and acknowledge that their fear or their concerns are real. So, Angela, do you have something you'd like to add to the conversation?
Well, one of my peer side experiences has been with an alpha who needed to go out of state for a liver transplant. And with my dad's liver transplant, we ended up going out of state for his surgery. And I was able to share our experience about going out of state to a transplant center and share with her some of the things that we learned from being there and kind of what worked, what were some of our challenges, and what we went through. And the one thing I really try to share with everyone that, when I'm being a peer guide is that you have to be your own advocate. And with liver disease, a lot of people have encephalopathy. And so in that type of situation, you have to have someone be an advocate for you when you're unable to have a voice. And that was something that we learned a lot going through the issues of liver disease and through liver transplants. And we knew my dad very well in the fact that he would come across okay, but if you talked to him for a couple minutes, you would realize that his encephalopathy was not good and that he was really encephalopathic. So, and there were certain things that we learned from being out of state. So we were able to help. I was able to help this person, sharing with her our experience about going out of state and what worked, and I tried to ask her questions as far as what her fears were or concerns were, and in that case I was able to express what we learned and help her through that process. And I know she told me at the end of our conversation that she felt much better about going out of state after talking with me, and that she didn't feel as alone going through this journey, knowing that someone else had gone through this before her. And as far as me, it helped me to remember what we went through and how it made us stronger as a family. And I appreciate every single day I get with my dad. And, you know, a bad day, sometimes, you know, it's like I have to stop and remember, wait, this could be so much worse. And, you know, I look at life a lot differently now after going through that with him.
Absolutely. And if I recall, I served as a peer guide to Angela when her dad was first diagnosed and helped walk her through some of the things that she should be watching for, and we talked in great length about the encephalopathy and how somebody would have to be advocating for her dad because he wouldn't be able to whenever he was having an encephalopathic episode. So Angela, thank you so much for sharing. And I think that's another key, that as a peer guide, one of the things that we always try to impress is be your own advocate. And I answer the patient hotline, and I was talking to a patient yesterday who said, you know, I just always took what the doctor said at face value, and I never questioned it. And then she made the point that she has had to learn more about alpha-1 than she thinks her own doctor knows, and she thought that was strange. And I told her it absolutely was not strange, that most of our patients know more about alpha-1 than their own doctors do, unless they happen to be paired with a doctor who is one of our alpha docs that is very knowledgeable. But, you know, the average doctor in the average town doesn't know a whole lot about alpha-1, and sometimes that's our biggest job, is educating our healthcare professionals. So, thanks, Angela, for sharing. Ted, would you like to share your experience as a peer guide, or what you received as a peer from a peer guide?
Sure, absolutely. You know, I'm one of those individuals that's lucky enough to have hit the alpha-1 grand slam. I ended up as lung affected, liver affected, with cirrhosis in the liver, as well as having liver cancer. So, you know, I've been able to go through so many different things, which has really helped me. It helped me grow as a person individually, just going through it. You know, my peer guide that I teamed up with, and he's actually my support group mentor, has been really helpful. And you know, I try to carry on what he carried to me, is a lot of everything that every one of you all have already said. You know, it's a lot of listening. It's a lot of learning to become a self-advocate. During conference this year, I was fortunate enough to spend some time with someone who was there with her daughter-in-law and 2 grandchildren, and just sit and listen, you know, and be there to answer questions and to help them. And you know, they were intrigued about my story as I was about theirs, and so we built a good bond and a good relationship. It's very important, you know. Sometimes, like Ken said, you know, sometimes you just have to not even say a word, just listen. You know, and you learn as much about yourself sometimes as you do about them as well. And it's, you know, I've been very fortunate because I've had a lot of great information handed to me by a lot of people that's been through a lot of things. I've spent a lot of time talking to a lot of people, and I think it makes me better at helping someone else, not only because I know more about myself, but also know more about a lot of the things that we're all going through.
Thanks, Ted. I think you're right. I think we as peer guides are learning from on both sides of that experience. So I'm going to just open it up for discussion. Are there any questions or any comments that anyone would like to share?
My name's Ed. I got a question.
Sorry, I just joined.
Sure, Ed, go ahead.
Really late.
All right. I just was diagnosed with alpha-1, so I haven't even started my treatment just yet. I've got this bad cough that's driving me up the wall. How long does the medication, does that actually relieve the cough, or will I always have that cough?
When you say medication, are you talking about the augmentation therapy?
The infusion?
Yes.
Okay, no, I received that tomorrow, and I'm hoping to get my first infusion this week.
Okay. So you're asking if the infusions will take care of your cough?
Yes. Okay, yeah, I've never had the cough until like December, and then it just started getting worse and worse. And I finally went to various doctors, and then finally went to a pulmonologist, and he was able to diagnose it as alpha-1.
Augmentation therapy in itself probably will not do much for the cough, but it may relieve some of the inflammation. It may. For a cough, most oftentimes I've seen inhalers with steroids included prescribed. But again, that's something you need to discuss with your doctor. Maybe a steroid inhaler might help. Okay, but you can't expect the augmentation therapy to make you better. It's designed to keep you from getting worse. Okay?
Okay. Now, I'm already on a Pro Air inhaler right now, so it's still not doing any good for me. It hasn't done anything for my cough.
Yeah, with the cough, there could be any number of reasons. It could be a bronchiectasis in there. It could be inflammation from something completely outside that possibly would have been healed up by the alpha-1 protein. It's any number of different things. It may be something an inhaler can work with. It may be a whole other story. So that's where we get caught in this thing that, we get treated as alpha-1 patients with the replacement therapy, but at the same time, a lot of us are also being treated as COPD patients because there's specific treatments for COPD that an alpha gets those as well as the augmentation therapy. So I think you need to have some more conversations with your pulmonologist about that cough, and if he's saying, well, let's try the infusions and see if that clears it up, I think you're going to need to push him a little more on that.
Okay, thank you.
Or I might add, maybe you might investigate going to a CRC Center of Excellence with experienced alpha-1 doctors.
So let me expand a little bit on the comment that was made about a CRC center. We have what we call clinical resource centers, and they're on our website, the Alpha-1 Foundation's website at alpha1.org, and you click on, you say at the very top there's a scroll and it says Find a Doc, and you click on that, and then you click on your state, and hopefully we have one in your state, and they're listed there, and you can choose one of those doctors that's listed there who has applied to be a resource center for us, and that means that they have at least a minimum of 5 to 7 patients with Alpha-1, and that they have some expertise in Alpha-1 that a normal doctor doesn't. They also have to take a test and pass that test that's administered with the oversight of our medical director, Dr. Robert Sandhouse, at National Jewish in Denver. So these doctors are someone who have better than normal average information about Alpha-1. And I was talking with a patient today that said, well, 5 to 7 patients doesn't sound like a lot. But for a rare disease, for a doctor to have 5 to 7 patients is a pretty good practice. And many of those doctors that are on there have a lot more than 5 to 7 patients.
Well, I was just going to mention, this is Ken, that as you go on to the Alpha-1 Foundation website and find these doctors, you'll also have telephone numbers and emails listed for them in addition to their address. And should you contact them by either one of those methods and get involved in a dialogue with them, and that may go a long ways towards resolving your coughing issue also.
Absolutely. Ed, what state are you located in?
I'm in Florida.
Okay. Well, you've got a wealth of doctors available to you in Florida. Dr. Mark Brantley at the University of Florida in Gainesville, Dr. Michael Campos in Miami. There's a number of doctors that are very good doctors in Florida. And what a lot of our patients do is they will go and have an appointment on an annual basis with one of our CRC docs, and then they may be followed in their local city by their pulmonologist. But once a year, they'll have that visit with one of the CRC docs to make sure that they're on track and what they're doing is working and that sort of thing. I'll give my phone number when we finish this evening, and if anybody wants to call and get additional information about anything that we've talked about tonight, you can give me a call tomorrow.
Cathey, I would also say to Ed, there are any number of support groups in Florida, and a few of them are having support group meetings soon. So depending on where he is, he might be able to be connected there.
I'm up in the Panhandle, northern part of Florida.
Yeah, there is a new group that just started in the Panhandle, and you can find that on our website as well, Ed.
Okay. Appreciate that.
Sure, absolutely. Does anyone else have any other questions?
Hi, my name is Bethany. I had gone to a support group meeting in my local area, and it's now been disbanded. So I don't know how to, I reach out to alphas online, but I don't know if there's any way to get a hold of, like, local alphas, like get another support group going in my area.
Cathey, you're the person to take that.
Yes, I am the person to take that. Bethany, what area are you located in?
I'm in DFW, Texas, like Dallas-Fort Worth area.
There is an active group in the Dallas-Fort Worth area. Jennifer Jacks is the support group leader. If you'll give me a call tomorrow, I can give you Jennifer's direct information, and we can talk about that. But there is a group there. Our support groups, all of them meet. Let me talk about our support groups a little bit.
Okay.
We have over 80 groups throughout the United States, and it is suggested that they meet a minimum of 4 times a year. Some of the groups meet more frequently than that, and some of them meet in the wintertime but not in the summertime. Some meet in the summertime and not in the wintertime. So depending on their locale, and it really is a decision for the group to make. The support group leader will have a meeting. They will get the feedback from the group as to how frequently they want to meet and when and where and that sort of thing. And then the meetings are set. And they're listed on, all of our support groups are listed on our website at alpha1.org. And they have an educational component to their meetings, either via a live speaker or by importing some of our recorded sessions that are available to do, and we also will Skype with some of our speakers. So it's an educational event, and usually it's based around a lunch or a potluck dinner or a dinner, and it's a time for the groups to come together. So, Bethany, if you want to give me a call tomorrow, and let me give my phone number out to anybody on the call tonight. My direct number is 877-346-3212. And I'm happy to help anybody that has any questions, or if you're interested in being assigned a peer guide I'm happy to talk to you about that and assigning a peer guide to you that fits your whatever it is that you might have questions about.
Need one of those too.
All right.
Okay, great. Thank you.
You're welcome. Does anyone else have anything that they want to share with the group this evening? Well, first of all, I'd like to thank those of you that came on tonight as our peer guides to explain the process that you have gone through as a peer guide. And some of the things, one of the things that I was going to share is there is not an experience that you could be having that probably somebody else hasn't already had. I had a call a few weeks ago, and the person said, I bet you don't have someone that's had to have a lung and liver transplant. And it's like, well, as a matter of fact, we do have someone in the community that has signed up to be a peer guide that has had a liver and a lung transplant. And so there's probably not anything that anybody in this community is facing that someone else hasn't already faced that we can make a connection for you guys. And not only from a patient standpoint, but also from a caregiver standpoint. And I think that's very important to remember that Alpha-1 is just not an individual diagnosis, it's a family diagnosis. And it affects everyone in our family, and especially those that are our immediate caregivers. And so keep that in mind. If you are an Alpha on the phone tonight, that your loved one who's taking care of you, who's walking the steps with you, they may need someone to talk to as well. So we do have caregivers that have volunteered to share their journey or to listen to someone and offer any type of assistance that they can. So whether somebody's having to go on supplemental oxygen for the first time, whether that's at night or if it's 24/7, traveling with oxygen, traveling to high altitude, a lung transplant, a liver transplant, a lung and liver transplant, liver cancer. Ted was shared with us this evening about his diagnosis and what he's been going through. So there's all kinds of things that people are facing, and there is someone that has probably experienced that same thing. So don't be shy, and if you have someone that you want to talk to something that you want to talk to someone about, give me a call, and I will certainly try to connect you with someone who's had that kind of experience. And again, I'm going to repeat my number. It's 877-346-3212. And I just want to say thank you to everyone that has shared experiences this evening. And if I can help any of you guys that or have questions or would like a peer guide, don't hesitate to give me a call, and we'll get you signed up and talking to someone on a one-to-one basis.
Cathey, I do have one more thing, if you don't mind.
Sure.
I'd just like to say that for anybody else who's on the call that's newly diagnosed like Ed or anyone else, if you haven't talked to your family and talked to them about getting tested as well, please do so. You know, this not only affects you, but it affects your offspring, your children, their children. You know, definitely have that conversation. There's plenty of people that are available that could tell you how to do that and ways that'll make it easier. Reach out to a genetic counselor. We have that option available as well, but by all means, please make sure that you get your family tested as well so that they know if they need to start dealing with things now rather than wait till later like a lot of us did.
I appreciate the info. We've already taken that step by sending off test kits to all my intermediate family and that. Thank you.
That's fantastic.
Thanks, Ted. That's a very good point. Thanks for sharing that. And Bethany, Ed, Donna, if any of you have questions, and I think there's some people that I didn't get to hear that are on the call, don't hesitate to give me a call and we'll get you connected. And you've heard some examples of the peer guide talking this evening. So there is someone out there that is just the perfect person for you to talk with. And that's what we're here for. So guys, thanks everyone. And we'll end a little bit early this evening and everybody can get back to their Tuesday night routine. Thank you for joining.